For Body Chemistry Associates and Health Connection Radio, I'm your host, Jay Foster. Today we want to talk all about the topic of statin drugs and coenzyme Q10. Now, nowhere will you hear me say don't take a statin drug because I'm a biochemist, not a medical doctor, and I don't tell you to start or stop any medication anytime. So if you're choosing to take a statin drug, it's very important that you take coenzyme Q10 with it. And there's a lot of literature behind this and a lot of experience. Dr. Steven Sinatra, some of you may know, a board-certified cardiologist, very much involved in nutrition. He's written probably dozens of books. One book he wrote was called The Coenzyme Q10 Phenomenon. And realize he's a board-certified cardiologist. And that was published by Keats back in 2000. And in that book, he said that the statin drugs used to lower cholesterol, like Lipitor and Crestor, et cetera, and the other ones, may affect the liver and deplete CoQ10 from the body. This may lead to congestive heart failure and increased risk for breast cancer. Also, most of the side effects of statin drugs are due to a CoQ10 deficiency. Now, why this whole thing happens is that statin drugs are called, they inhibit an enzyme that produces cholesterol. So if you inhibit the enzyme, the cholesterol comes down. The total cholesterol levels come down. And the LDL, the bad levels, come down. But at the same time you do that, that same enzyme produces coenzyme Q10. The enzyme's called HMG coenzyme A reductase. So statin drugs are termed HMG coenzyme A reductase inhibitors. So when you inhibit that enzyme, yes, you lower the production of cholesterol. What they don't tell the physicians, unfortunately, is that you also lower coenzyme Q10. Now, Merck had an early patent on giving they did the original research on statin drugs like Mevacor, and they had a patent, and they knew that if you give CoQ10 with the statin drug, that the symptoms like muscle pain, muscle weakness, congestive heart failure, rhabdomyosis, which is a kidney condition that can kill you, memory loss, all those can be prevented if you take the statin drugs with CoQ10. And that is something that your doctor may not know about, didn't tell you, and it's very, very important. So this is back in June of, what's the year here? Magnifying glass time, 1990, June of 1990. And this is from the patent, the U.S. Patent Trade Office, uspto.gov. And the patent number that Merck got on this is 4933165, 4,933,165. 4933165. I give that patent number out on all the radio shows I've done over the years on this subject, and haven't seen any lawyers really pick it up. But that's how far back the patent goes. And Merck was doing research, and Carl Folkers was a PhD researcher who Sinatra met and interviewed and talked to and learned about CoQ10. And then I think Merck sold it to the Japanese, but anyway, at least we can still get it. So this patent says CoQ10, I'll translate it. It doesn't say this, but this is it says coenzyme Q sub 10 with HMG coenzyme A reductase inhibitor, basically taking a statin drug with CoQ10, and they say that the amount you take a certain amount of statin drug, you take a certain amount of CoQ10, and it prevents the muscle pain. Another one that says prevents liver damage. So you have every time you take a statin drug, you are depleting CoQ10, and you have to take it. You just have to. Here's an article from the Journal of the American Associations of Nurse Practitioners in 2013. Statins' effect on plasma levels of CoQ10 and improvement in myopathy, which is muscle pain, with supplementation. It says results found a significant relationship between between statin intake and decreased serum levels of coenzyme Q10. And Archives of Neurology, again in, where is this, 2004, Lipitor or atorvastatin decreases the CoQ10 level in the blood of patients, putting them at risk for cardiovascular disease and stroke. It says even brief exposure to Lipitor or atorvastatin causes a marked decrease in blood CoQ10 concentration. This inhibition of CoQ10 could explain the most commonly reported adverse effects of statins, especially exercise intolerance, myalgia, which is muscle pain, and myoglobinuria, which is finding muscle protein in the urine. Also affects memory. It's quite possible. Dwayne Gravelin's a MD NASA astronaut who wrote a book. He had such a drastic reaction on his memory. His book is called Lipitor, Thief of Memory. I've interviewed him and find his radio shows on our website at 1-800-chemist.com. So there's a lot of different CoQ10s on the market. We found the one that Dr. Sinatra developed after working with Carl Folkers, the original researchers on this. So we just copied their formula. We didn't copy the formula. We actually have their exact same formula. Theirs was called Q-Gel, capital Q-Gel, with a trademark after the gel. Ours is called Super Q-Gel. It's the exact same formula. And so you can get it from us at 1-800-Chemist, or you can find it at a health food store. But they'll try to sell you a different type, say this one's better, whatever. I have never had a reason to change formulas since I started using this under Dr. Sinatra's guidance when we had him on our radio show a number of times back in the late 80s, I guess it was late 90s. So the fact that your doctor doesn't know is because no one's told them. It doesn't mean that it's not accurate. It's because Merck didn't ever bother to exercise this patent that they had, or to tell the doctors where the muscle pain and all these other conditions are coming from. So Dr. Sinatra says there's no downside to taking the CoQ10, the Super Q Gel. If you're taking a statin drug, we recommend about 4 a day, 2 in the morning and 2 at night. For other, and you should, especially if you're seeing muscle pain, muscle weakness, or a number of different conditions, including congestive heart failure. If you'd like some more information on this, you can hear radio shows we've done on the web at 1-800-Chemist.com. More information on our testing programs, where we find out which nutrients you need based upon your individual chemical profile. The Body Chem program available widely, both locally and long distance. This is our 36th year in the field of applied clinical nutrition and nutritional biochemistry. More information on programs, 1-800-Chemist, 1-800-243-6478 on the web, 1-800-Chemist.com. On Facebook, you'll find us under Body Chemistry Associates. This is Jay Foster on Health Connection Radio saying thanks for tuning in today. Enjoy the rest of this beautiful day. We'll be with you with another podcast in a very short time.